So at Proximie, it's always about the stories. That's why it exists. That's why I created Proximie. It's really about being able to change people's lives. How can we, in a very humble approach with our transaction of innovation and technology and healthcare, make that difference? We don't talk about what code we use or what cloud system we're using. It's really about whose lives are we changing and how are we changing them for the better. Our company stand-up call always starts with a mission and vision story. Someone in the company stands up and says, this is how Proximie was used this week, and this is the life it changed. And it's those things that get you through the ups and downs of a fast-growing company. And it's always exciting and exhilarating, but also humbling at the same time. So I was born in San Diego, California, a beautiful sunny part of Southern California, and was lucky to have a very privileged upbringing. Everything we needed, we had. But at the age of 10, my parents decided it was time to move back to Beirut, Lebanon, to connect with our broader family, to get closer to our heritage and our culture, and to learn more about where we came from. The early 90s in Beirut was an interesting time. It was post-war. There were many things that probably as a child I'd taken for granted that weren't as available there. Simple things like water, electricity. It was a pretty big culture shock for us, but one that I think shaped, the rest of my life. That recognition of the fragility of life, but also taking pleasure in the simple things: family, community, purpose. I've been very lucky. I have really fantastic parents. My mom was a teacher and a child psychologist, and my dad was a computer engineer. I'm one of 4 sisters. I have a twin sister and 2 younger sisters. And when I look at, my parents, even till this day, they're just incredibly proud. Their ask has always been of us to make sure that we always have a path to independence and rely on ourselves, that it doesn't matter if you're male or female, we can do whatever we put our minds to. And I think for them, having 4 daughters, that was an important message. I have 3 children, Khalid, May, and Kareem, and my husband, Walid, all of whom are a constant source of inspiration. My family lives and breathes the journey I'm on as much as I do, and I couldn't do this without them. My grandma, Layla, was a big influence in my life. She was very, very well regarded within our community. She was such a matriarch in our family as well. She was also very involved in charitable efforts that were really focused on empowering women. And so from a very young age, I was seeing firsthand how fulfilling and how rewarding it can be to give back. In 1996, there was the Grapes of Wrath, a very difficult time in Beirut, and there was a lot of instability, and it wasn't very safe. People dying from these situations. For me, at least, what was impacting me was the morbidity. The fact that people who had survived these attacks or had survived these situations were now left with consequences of war and trauma that really affected their life. I started asking, how are you going to help these people? These young girls with burns contractures who can't walk properly, or these young kids. An extended relative was visiting from New York, and he was a plastic surgeon. And he said, look, I'm coming a few times a year to try and help. I do small operations on these young children to see if I can give them a better chance. And I was incredibly curious. I wanted to know, what does that mean? How can you actually help them? Can you change their lives? And he said, yes, that's what plastic surgery is. And for the whole day, he was doing procedures on people who had suffered contractures and problems. And then we would see them in the clinic afterwards and see how they were improving. And that was it. I never looked back. That was exactly the path I wanted to take. And even till this day, every single day that I'm in an OR, I get that excitement, that buzz. It's not just about you, it's about the team. You have, at least 3 to 4 to 5 people in the room, all dedicated to the benefit of this patient on table. I don't know many jobs that have that kind of privilege and luxury. So I feel very, very fortunate to be a surgeon. In my surgical training, I started to get involved with global health initiatives, even as a medical student. And so for 10 years, I would travel, at least 6 to 8 weeks every year to different parts of the world, looking at capacity building, sustainability in surgical care. My concern over time, though, was, how much of an impact was I able to make, and how sustainable was these efforts and efforts like many other surgeons. For me, the moment when the Lancet Commission published that 5 billion people lack access to safe surgery was a real kind of moment to pause and think about what I'd been doing and dedicating the last 10 years to, and was I really making the impact that I personally wanted to make? Could I really shift the needle? 5 billion people was such a big number. So I've always been interested in innovation and that intersection of technology and healthcare, especially as we were seeing this movement towards digitization. And so I started to imagine a world where operating rooms all around the world were connected, digitized, collaborative, intelligent. Imagine smart ORs and intelligent ORs that were enabling us to scale expertise and reduce variation, upskill and drive workforce capability at much bigger pace. And ultimately, and most importantly, make sure that every patient gets the best access to care the first time, every time. What if I could, within a moment, virtually click in and be in that operating room? share best practice, learn from them as much as they'll be able to learn from me, and reimagine what surgery could really look like. This had to be accessible on any device anyone had. It's about that democratization. It had to work on low bandwidth, and it had to be something that could evolve rapidly. What I really wanted to do was bring the best of human expertise, combined with the most advanced technologies and software to change surgery. After about a year of using the technology, we were really able to show a huge acceleration in skill acquisition. People felt well supported in their operating rooms by experts who were dialing in and working through the cases with them. At the same time, they were able to show colleagues around the world what work they were doing. And that kind of globalization of surgery was something that hadn't been possible before. And it was in 2016, so 2 years later, Proximie was used in a unique, austere environment to support a blast injury. And CNN had caught wind of the story and had published this editorial, "Could this be the future of surgery?" It had gone kind of viral and people started to reach out. Really, the rest is history. We went from a small team to now over 110 people delivering Proximie in tens of countries around the world. Prepare, perform, perfect. Imagine a digital continuum. Every surgery, recorded, connected, collaborative, reviewed. That's the way surgery should move forward. Being part of a connected surgical continuum, where we're able to really capture that information and crowdsource knowledge from all around the world to reshape and to accelerate how we deliver surgery. Every single interaction is tagged and stored into a library. You can come back and review that. You can collaborate with colleagues to get feedback about that case. You can actually go back in an objective way and evaluate performance. We recognize that surgery, skill acquisition, review of performance, collaboration, analytics is across your lifetime as a surgeon. Whether you're a first-year medical student or you're a surgeon at the top of your game, you still go through that continuum of reviewing, prepare, perform, perfect. A platform that is ubiquitous and can be used by all members of that journey really means that your user will be a lifetime user. And that's how we change the paradigm in surgery. We are not bringing a point solution to the problem, we're bringing a systems change. What's important to me is that Proximie's platform is used all around the world. Whether you're in the most advanced teaching hospital in the center of a big city in the US or in the UK or Europe, or you're in a small community hospital in an area that has one specialist across the whole population, we need to all be able to have access to that solution. And so today, Proximie is used in over 50 countries, all around the world, enabling doctors to collaborate and share best practice. But we still have a lot more to do. Imagine that connected surgical care continuum, pre, intra, and post-op. Solutions and technologies coming together, integrating across an OS. And Proximie being that OS of the operating room, enabling connectivity, collaboration, data and analytics and intelligence, turning these rooms into smart ORs, taking surgery beyond the operating room to the pre and the post-op as well. We have a lot to do. There's a big world out there that needs Proximie, and so we need to work really hard to make sure that we can enable this to be delivered at scale and at pace, and that every single person that uses our software or platform has a beautiful experience. Because by having that beautiful experience and seeing the value from the first time, they will become the vanguards and the champions for Proximie for many years to come. We have a multinational group of people working together, solely focused on improving people's lives and making sure that they all have access to the best surgery.